Aloha, welcome to Real Talk with Sandy. I'm Sandy Hale, retired nurse and Redan Fields consultant for the last 6.5 years. So today's product video is a little bit different. I'm actually going to share with you how I incorporate occlusion therapy into my skincare routine. And let's just go into what occlusion therapy is. So it's basically what it breaks down to is 100% coverage of your skin, right? That's occlusion. And so what it's doing is you're gonna actually be utilizing any type of plastic, right? Plastic food wrap. This is how we're gonna occlude our skin. And what happens when we're doing this occlusion is it causes your skin to have a higher absorption rate, which then equals, right, greater effectiveness on the skincare treatment that you're utilizing. So for myself, I am someone who has sun damage. I've had sun damage for years. I grew up here in Hawaii. If you've ever seen any of my other videos, I've talked about this before as well. I just did not apply sunscreen. I played sports as a child, went to the beach all the time. And it wasn't until I probably was in my late 20s, maybe early 30s, that I realized I probably should start to wear sunscreen. That's when the awareness came. And about in the mid 30s is where freckles started to appear, which then started to conjoin and they became age spots. So I'm going to share with you how I utilize this occlusion therapy step by step, all right? So I use this regimen right here. This is my go-to. It is Redan Fields Reverse, but this is the Lightening, all right? Redan Fields has two types of reverse. You could use this for either one of them, but this is mine because I do have these stubborn dark marks from being in the sun for, well, I'm 42 now. So, and I still go into the sun. I definitely use sunscreen. However, I do need to reverse the 30 plus years of sun damage that I did do to my skin. So this is my regimen of choice. So how we incorporate occlusion therapy into the skin routine, okay, is, so I start with my face wash, and you're gonna do that too. You're gonna start with your face wash. You're gonna gently, wash your face. You're gonna rinse with lukewarm water, and then you're gonna pat dry, all right? For me, step 2 is the Lightening toner, and our products are all numbered. And this Lightening toner has kojic acid, it has licorice, and it also has 2% of hydroquinone, which assists in the skin lightening, okay? And then in this regimen, there's a step 3 that is the skin lightening treatment. So for this, I put a pea size on my finger, and I go ahead and I put it all over my face, avoiding though the eye area, okay? You're not putting toner or step 3 in your eye area, okay, but everywhere else. And so once my step 3 is on, I then go ahead and this is where the plastic food wrap comes in, okay? This one, of course, this is a big one. We get this from Costco. And for the sake of this video, I have actually cut out pieces because it takes me a little bit to do this and kind of not fumble and not make it all messy. So what I do is, here's the saran wrap, right? Cling wrap, plastic wrap, whatever it is that you're using. And for myself, I have 3 areas that have stubborn dark marks, okay? So for me, I take this and I place it here. So on this cheek here, which you can see it sticks, right? It's perfect. You don't have to worry about trying to get it to stick. It sticks to your skin. So I put mine here on this cheek. I do one also on my forehead because my forehead is an area that I also have sun damage. And then I take one more piece and I actually put it on this cheek because again, that's where I've got the sun damage. So really wherever you have sun damage, maybe it's your nose, maybe you have it in the same areas, maybe it's only one side, because I will tell you that my right side has more sun damage than my left. And the reason is, growing up, right, you're in the passenger seat and you're sitting there. I used to hang my head out the window. So this side is definitely darker. My sun damage is more prominent on that side than it is on this side. So what you're gonna do is, with the plastic wrap, you're actually gonna leave it on for 2 hours, okay? So I do this at night. I do not do this in the morning. I do it in the evening. and I leave it on for the 2 hours, and then once the 2 hours are up, I take it off, and then I just go ahead and I gently rub in again, okay? I just rub in, and what I've seen is it has increased the effectiveness of my skin lightening. So if I go out in the sun, especially as an example, my daughter plays softball. So if I go for a tournament and we're there for the whole weekend, regardless of me wearing sunscreen and being under a UV umbrella, I still get sun rays that kick up from the concrete. I'm sitting on metal bleachers. So all of that, it still kicks up and it still gets in there, right? Even though I am covered, it still happens. And so if I'm out in the sun that way, or I get caught without the umbrella and I'm sitting and I don't realize it, guys, our skin is living and breathing, right? And every time sun hits it, melanin starts to form. So what will happen is I kind of take myself backwards a little bit when I am in those days and I'm doing that. And so this occlusion therapy helps me to take care of the new, as well as, like I said, reversing the old, okay? So I wanna do a little disclaimer here. I am in no way a doctor, I'm not a dermatologist. So if you would like to, I would highly recommend, you can talk to your dermatologist or a doctor asking, hey, this is what I saw, can I try this with my products, okay? Also, if you are new to Redan & Fields, or if you're new to actually any of the skincare regimens that you yourself are using, I would 100% recommend that you acclimate your skin. So with our RNF products, we have a brochure inside, and it actually has you acclimate your skin for a month. Meaning we start off with every other morning using the products for the first week. Second week, you're doing every morning. Third week, you start to incorporate evening, so it's every morning and every other night. And so by the fourth week, once you hit a month, you're doing your products every morning and every night. So before incorporating occlusion therapy to your regimen or your skincare treatment, I would 100% recommend that you have already acclimated your skin, all right? Don't try something new and then increase the absorption of it if you don't know how your skin is going to react to it. Thank you for joining me. Subscribe to my channel. You can share this video, and I would love to actually see your before and afters when you start to incorporate occlusion therapy and how you've seen it change and just increase the effectiveness and the results of your skincare products as well. Aloha.